What helps overcome fears of schizophrenia misdiagnosis? Imagine feeling unsure about your mental health and worried about being wrongly diagnosed with schizophrenia. That concern can be very stressful. But knowing how diagnosis works can help ease those fears. The key is relying on proper clinical assessment tools. These are structured methods used by trained mental health professionals to evaluate symptoms carefully. They include standardized interviews and rating scales that help distinguish schizophrenia from other conditions. This process reduces the chance of mistakes. Clinicians look at a person's full history, symptoms, and how they change over time. They also rule out other medical or psychiatric issues that might look similar. This thorough approach makes the diagnosis more accurate. Mental health experts are also trained to recognize common thinking errors that can lead to misdiagnosis. For example, they watch out for biases like anchoring bias, where they might focus too much on an initial impression, or confirmation bias, which favors information supporting a preconceived idea. To prevent these errors, professionals often discuss cases with colleagues or use reflective practices. This helps keep their judgment clear. For individuals worried about being misdiagnosed, psychological support like cognitive behavioral therapy can be very helpful. This therapy helps manage obsessive thoughts about illness fears. It teaches coping skills and reduces anxiety, making fears less overwhelming. Education is also a big part of reducing worries. When patients understand that diagnosis involves looking at patterns of symptoms over time, not just a single test, it becomes easier to trust the process. Explaining that diagnoses are flexible and can be updated if new information appears reassures many people. Follow-up assessments are another important tool. They allow clinicians to monitor changes and adjust diagnoses if needed. This ongoing process shows patients their diagnosis is not set in stone. It also provides reassurance that their care adapts to their situation. Addressing stigma around schizophrenia is vital too. Many fears stem from misconceptions and negative stereotypes. Public education campaigns and open conversations help reduce stigma, making it easier for people to accept their diagnosis or avoid unnecessary fears. In summary, using accurate clinical assessment tools, being aware of diagnostic biases, providing psychological support, educating patients, and maintaining continuous follow-up all help reduce fears of misdiagnosis. These steps ensure that diagnosis is as precise as possible and that individuals feel supported throughout the process.